Since the COVID-19 pandemic, face masks has played a vital role globally in preventing the spread of the disease. However, the Thai government announced that wearing masks was no longer considered mandatory, allowing individuals to choose whether to wear masks, although face masks are no longer required. WHO still recommends that those with a high risk, such as elderly, should still wearing masks in public. But will all the elders wear masks every time they go outside? And if they will, what are the factors that sustain their mask wearing behavior? For the objective, to determine the factors which contribute elderly who are still wearing masks in a rural area in post-COVID-19 pandemic era, meanwhile also the prevalence. This study is mixed method, sequential, exploratory design. The inclusion criteria are people who live in Phramongkutklao village and have age 60 years or older. And the exclusion criteria is the elderly who have decision-making disability. Let's move to the phase of study. On the qualitative phase, an in-depth interview was conducted to investigate specific factors influencing mask-wearing behavior to develop theme and codes. The questionnaire is conducted from the course and literature review, and then the content validity were assessed, and conduct alpha score for pilot study were reliable. Finally, a cross-sectional study was carried out to identify the prevalence and using exploratory factor analysis or EFA for conducting domains and analyze data by using Stata 17 version and structural equational modeling or SEM. For the result, 15 elderly participants consisting of 9 males and 6 females aged 60 to 72 years were enrolled to conduct an in-depth interview and form the 7 sub-teams, which 4 of them are in facilitators and 3 are in barriers. And this is some part of the result showing on the screen. Our quantitative result show that from 201 elderly, approximately 60% of the participants were female and aged between 60 and 69 years. 3/4 of the participants' highest educational level was primary school. Almost half of all consume alcohol, and 70% of all had used endographis paniculata or fatalizone to treat or prevent COVID-19 infection. And the prevalence of elders who wear masks is 81.1%. And the next step for analysis, we use the EFA to group domains from the questionnaires, and 9 domains were conducted. As shown on the screen, this table demonstrates the mean differences in factors influencing mask wearing among the study population stratified by domains. We found that almost every domain are statistically significant, except these 3 domains, which is misconception, discomfort, and affordability. Then we use data for performing the SEM framework. This is a full version of SEM, but I will explain in the simplified version for the better understanding. First of all, the goodness index was checked, show that all domains are acceptable. From the result, we found that social norm has a direct effect on mask wearing practice and a negative direct effect on barriers. Motivations, which is a second-order factor extract from threat, alternative threat, and perceived benefits, has a strong direct effect on mask wearing and willingness to wear masks. Surprisingly, barriers are second-order factors derived from discomfort toward mask wearing, cost, and misconception has a positive direct effect on willingness to wear masks. And in summary, Our study revealed the prevalence of mask wearing is 81.1%, which is lesser than some studies which report more use face mask. The differences among each study results may be explained by differences phase of COVID-19 pandemic, population group, and official measurements. The key determinant for sustaining face mask behavior among rural elderly individuals were identified as social norms. Encouraging behavioral change within the community can be initiated through the implementation of community rules, promoting local cooperation. In addition, this is important to enhance knowledge regarding COVID-19 prevention measures and proper utilization of resources, such as fertilizer. And the last one, the implication of the study extends to public health practitioners and policymakers who aim to develop target interventions to improve compliance and promote behavioral change among the elderly in similarly remote rural settings. Thank you.